One is personality disorder. Personality disorder are chronic maladaptive cognitive behavioral patterns that are thoroughly integrated into the individual's personality and that are troublesome to others or whose pleasure sources are either harmful or illegal. Um, Number two is schizoid personality disorder. Those with SPD may be perceived by others as somber, aloof, and often are referred to as loners. Um, number three, Number three is paranoid personality disorder. Although they are prone to unjustified angry or aggressive outbursts when they have perceived others as disloyal or deceitful, those with PPD more often come across as emotionally cold, excessively serious. Number four. Number four is schizotypal personality disorder. Um, this disorder is characterized both by a need for isolation as well as odd, outlandish, or paranoid beliefs. Number five is antisocial personality disorder. APD is characterized by lack of empathy or conscience, a difficulty controlling impulses and manipulative behaviors. Number six, uh, borderline personality disorder. This mental illness interferes with an individual ability to regulate emotion. Uh, Number six, narcissistic personality disorder. NPD is characterized primarily by grandiosity, need for admiration, and lack of empathy. Number Number seven, histrionic personality disorder. Individuals with this personality disorder exhibit a pervasive pattern of excessive emotionality and attempt to get attention unusual ways, such as bizarre appearance or speech. Uh, number 8 Number 8 is avoidant personality disorder. Those avoidant personalities are often hypersensitive to rejection and unwilling to take social risk. Number 9 is dependent personality disorder. People with dependent disorder are typically exhibits a pattern of needy, submissive behavior and rely on others to make decisions for them. Uh, Number 10, um, obsessive compulsive personality disorder. Individuals with OCPD, also called an ancastic personality disorder, are confused on order and perfection that their lack of flexibility interferes with productivity and efficiency. Uh, Number 11, personality disorder and criminality. Async believes that personality is the main factor in criminal behavior. Uh, has a decisive role in crime. Number 12. Number 12 is somatoform disorder. Uh, is a mental disorder characterized by physical symptoms that mimic physical disease or injury for for which there is no identifiable physical cause. Number 13 is conversion disorder. This is a condition where patient displays neurological symptoms such as numbness, paralysis, or fits even though there is no neurological explanation. Uh, number Number 14. 14 sensory symptoms. This includes anesthesia, excessive sensitivity to strong stimulation, loss of sense, of pain and unusual symptoms such as tingling or crawling sensation. Number 15, motor symptoms. In motor symptoms, any of the body's muscle groups may be involved: arms, legs, vocal cords. Mm, uh, 16, visceral symptoms. Examples includes trouble swallowing, frequent uh, frequent belching, spells of coughing or vomiting, uh, all carried to an uncommon extreme. 17 is hypochondrias. It is a somatoform disorder in which persons are preoccupied with their health and are convinced that they have some serious disorder, despite reassurance from doctors to the contrary. Mm. Somatization disorder. Also, Briquet's disorder or an antiquity hysteria is a psychiatric diagnosis applied to patients who persistently complain of varied physical symptoms uh, that have no identifiable physical origin. Mm. 19. Pain disorder. It is when patient experiences chronic pain in one or more areas, and is thought to be caused by psychological stress. Um, 20. Body dysmorphic disorder. It is previously known as dysmorphophobia, and sometimes referred to as body dysmorphia or dysmorphic syndrome. 21 is undifferentiated somatoform disorder. Only one unexplained symptom is required for at least 6 months. Number 22, uh, fac- factitious disorder is the term used to describe a pattern of behavior centered on the exaggeration uh, or outright falsification of one's own health problem or health problems of others. 23. Malingering is not a form of mental illness. However, people who adopt malingering behaviors often have diagnosable mental illness called uh, antisocial personality disorder. Hmm. 24. Dissociative disorder. Dissociative disorder refers to disorders in which, under stress, one loses the integration of consciousness, identity, and memories of important personal events. Uh, 25. uh, 25 is the psycho psychogenic amnesia. Uh, it is also known as dissociative amnesia. Is the temporary or permanent loss of all the memory,